everybody. Hello. Dr. Rafich here from Vet Triage. We are going to talk about hemangiosarcoma. Uh, I have a video on my channel. I think it's 3 parts that talks about splenectomy, which is the surgical removal of the spleen, which will be the main treatment option for dogs that have suspected hemangiosarcoma. So if you're looking for more details regarding the actual surgery, feel free to check out my channel with that. I know, as always, I want to say thank you for the playback crew. Thank you for watching, and feel free, everybody, to subscribe, like, donate, share, all the things. I imagine probably out of all the cancers I've spoken about, this might be the most common one amongst pet owners. And for those of you who are new grads or vet students, this also will be useful to you because it is a very, very, very common disease in dogs. So let's talk about it. Well, our focus on hemangiosarcoma, as I said in the title of this live stream, is visceral, meaning intra-abdominal organs are affected by it, because dogs can get hemangiosarcoma in any location in the body as a primary tumor. And the other common location for this, besides visceral or intra-abdominal, is going to be skin or subcuticular or muscular hemangiosarcoma, which we're not going to talk about. We're going to talk about specifically the intra-abdominal hemangiosarcoma, and even more specifically about the spleen and a little bit about the liver. That's going to be the focus for this. So, so for those of you who don't know, the spleen is an organ in the body. It's located on the upper part of the left side of the abdominal cavity. It's right after the spleen, or right after the stomach, rather, and it covers the left kidney. The spleen is important for many functions, including red blood cell maintenance, immune system maintenance, or functionality rather, platelet maintenance as well. It has a variety of very, very important functions. And in people, if you have to remove the spleen, they have chronic disease from missing a spleen, whereas in dogs, they can go without the spleen. So we don't really remove only a portion of the spleen, except for very, very, very rare circumstances. But dogs don't need their spleens for longevity, whereas people really do. So in people, they'll try to salvage the spleen. Even if they're removing a tumor, they'll perform a partial splenectomy and remove only part of the spleen. So anyway, that's a general overview, very general overview about the spleen. A significant proportion of splenic masses are benign hematomas. But the thing is, with benign disease, you can't tell whether or not it's benign or malignant pretty much before surgery. If you are advocating as a veterinarian for a fine needle aspiration of the spleen, which is inserting a needle into the spleen, usually ultrasound guidance, to see if whether or not that tumor that you're sampling on the spleen is cancerous or not, you're going to be disappointed, because most of the time it's going to come back as similar to peripheral blood, or it'll say something like extramedullary hematopoiesis, which is the ingestion of red blood cells outside of the bone marrow. And it doesn't matter. It's a benign diagnosis or a non-diagnostic result. And so fine needle aspiration of a splenic mass, although it is enticing because it's minimally invasive and it allows you to avoid surgery, or at least in terms of trying to find an answer, it usually is not accurate. And so the only way really of diagnosing this condition is by removing the spleen and submitting the entire spleen for histopathology or biopsy. You might ask, why can't you biopsy the spleen with ultrasound guidance in a minimally invasive way? Well, the problem is that you're inserting a large bore needle for the biopsy into a splenic mass that is filled with blood. And so the risk of you causing an iatrogenic hemoabdomen, meaning a hemoabdomen or internal bleeding, iatrogenically means by the doctor, is very, very high. It's almost a certainty that you're going to cause life-threatening bleeding. And now you've changed the scenario from stable and controlled to unstable and uncontrolled, and you have to go in for emergency surgery. So nobody biopsies the spleen in that manner at all. The metastatic spread of hemangiosarcoma in dogs approaches 100%. It's if your dog is confirmed to have hemangiosarcoma, almost always it's going to spread to other parts of the body. The liver is the most common metastatic site for the spleen, which makes sense because a splenic hemangiosarcoma is a cancer of red blood cells. And so any organ or organs that have red blood cells or have a vascular system, which is all of them, is prone to having hemangiosarcoma in those organs, or spread of hemangiosarcoma, because it's a vascular tumor. It's going to travel the blood, the vascular pathways, and whatever organ it lands on, it's going to spread to it. The survival times for dogs is correlated with clinical stage. Now, clinical stage implies the extent of disease. So we had talked about in previous YouTube videos and live streams about grade of disease and stage of disease. Grade is how aggressive is that tumor under a microscope, and stage is where is that tumor located in the body. So in hemangiosarcoma dogs, stage 1 means there's no internal bleeding, there's no spread of cancer. Stage 2 is there's internal bleeding, but there's no evidence of cancer spread. Stage 3 is you've got cancer spread. And so the worst prognosis is those dogs with stage 3. You need abdominal ultrasound to look at the diagnostic condition, although you can sometimes see it on radiographs, especially if it's big enough. Sometimes on radiographs or x-rays, it's hard to tell where it's coming from exactly, like liver or spleen, but abdominal ultrasound is the best way of doing it. Of course, you can consider a CAT scan or MRI, but those are not the most practical, especially if you have a dog with internal bleeding and time is of the essence. You really want to have radiographs performed and then abdominal ultrasound. Now, to look for metastatic disease, because it's almost 100% risk factor with this disease, CAT scan and MRI are way more sensitive for that. They can find smaller nodules that'll get missed on x-rays. And then your vet's always going to couple that abdominal radiograph or abdominal ultrasound with thoracic radiographs looking for metastatic spread. So 3 view chest x-rays to see whether or not there's any obvious tumors. Assuming, of course, you're not going with CAT scan MRI, which most people are not. You could also consider a heart ultrasound, so echocardiography, and you're looking for spread to the heart, because about 9% of dogs with splenic hemangiosarcoma will have evidence of spread to the heart, causing them to have right atrium hemangiosarcoma. And that may affect whether or not you want to pursue surgery, because if there's evidence of that already, then you may not want to pursue surgery for spread already. Problem is with echocardiogram is that you don't usually have that on an emergency basis available to you in the hospital, and many hospitals don't have it at all, regardless of what day or time they see the patient. Hello, audience member. Feel free to ask any questions you have about canine hemangiosarcoma or anything else. Happy to have you. So as far as treatment goes for this disease, the splenectomy is going to be your treatment of choice. So, and it can be done either in a controlled, scheduled setting if you don't have internal bleeding, or it could be internal bleeding, which means it's emergency, surgical emergency. So that's splenectomy, remove the entire spleen all the time with almost no exceptions. The only time you'll ever remove part of the spleen in dogs is if you know for sure that that splenic disease is from trauma or herniation, then it's okay to remove it. But even in that scenario, when you remove that part of the spleen, you're going to want to submit that portion that you removed for a biopsy to make sure it's not cancer. The problem is in dogs, the chances of having cancer are so high in splenic masses that you're obligated both ethically and legally from a medical board standpoint to remove the entire spleen. They don't need the spleen for their longevity, and because the chance of cancer is so high in dogs and it's so likely to spread, you remove the entire spleen. Hey, Daniel Brown, welcome back. Hi, how are you? Good morning. New Zealand, welcome. Yes, my good friend. Hey, man, thank you so much. Good vibes. Thanks for joining. Feel free to ask me any questions or make any comments you have. And then the other thing is with splenectomy, always, the doctor should biopsy the liver. They should biopsy a portion of the liver that looks questionable. If the liver does not look questionable at all, then remove some portion of or rather biopsy some part of the liver, whatever is most convenient for the surgeon to minimize complications. But you always want to make sure that the liver is negative for metastatic disease. So that's mandatory, and that should be done in all cases. In fact, all cases should have the entire spleen submitted for biopsy, as well as biopsying liver. Chemotherapy can help with this disease. It's only to be used really as an adjunctive tool after you've diagnosed splenic hemangiosarcoma, which means you've already gone through surgery. So you kind of can't really do chemotherapy in dogs for this disease unless you've done a splenectomy first. So that's just the way it is. The median survival time in dogs that receive splenectomy alone is 1.5 to 3 months. So it's only a couple of months that you get with these dogs as far as survival time. If you add in chemotherapy, you can potentially double that to 3 to 6 months. But the survival time for dogs with hemangiosarcoma of the spleen is very poor. And some pet owners are okay with investing thousands of dollars and all the risks associated with surgery and anesthesia with their older dog that only may have a couple months to live after surgery. And some people are not. And it just comes down to discussing the pros and cons of this with your veterinarian. Vet Triage is a fantastic way of getting information on this. Although obviously on Vet Triage, we can't perform surgery or chemotherapy. It is a great way to figure out, should I invest not just financially, but emotionally in my older dog for this surgery or not? And that's a great discussion to have on Vet Triage. And then finally, the prognosis really depends on clinical stage. So stage 1, 2, and 3, where 3 is the worst and 1 is the best, although none of them are really that good. But in terms of comparing dogs' survival times with what prognostic factors affect their longevity, clinical stage is the main prognostic factor. So yeah, hopefully that helps you guys out. Feel free to ask me any questions, leave any messages. Thank you, Daniel Brown, again for joining this morning, and thanks to the playback crew. I appreciate everybody's time. I should be on tomorrow, July 14th, and we'll talk then. Take care.